Thank you for joining us for some information about the Alzheimer's Association and awareness of dementia in general. My name is Jessica Duncan. I am a certified dementia practitioner and the walk manager for the Southwest Iowa area of the Alzheimer's Association Iowa chapter. We are proud members of the Council Bluffs Area Chamber of Commerce, and hopefully we can give some information on what we're doing here locally, as well as the Council Bluffs Walk. That will be September 23rd at Iowa Western. So if there are any things that you see today, please feel free to reach out to me for further information. My email address is at the end of this presentation, but jsduncan@alz.org is the easiest way for me to follow up with you. We will talk about some statistics. We'll talk about some awareness and some resources. So please feel free to share this with your friends. And if you would like any of these types of presentations done for your group, your team, or your family, please reach out to me. I'd be happy to facilitate that. We're always looking for volunteers as well. So this is my why I started working for the association. I actually became a volunteer for the Alzheimer's Association in 2017 before any of this had happened. These are pictures of myself and my dad. Steve is in the picture here when we were younger, and most recently at the walk that he was at in 2019. And this was a great event for us to really learn more about the impact of what dementia has done in the Council Bluffs area. And so, like I said, I started my professional career and volunteering for the association and dementia patients in general a little bit before 2017, but 2017 was when I became a volunteer. I was a CNA. I also got to help open a memory care and help dementia families within the home. And in 2019 is when we started seeing the first signs for him at 53 with a rare form of dementia called frontotemporal dementia with primary progressive aphasia. Like I said, his is very rare, but since one of the symptoms that he has is that it does take his words. I am honored that I get to tell his story. And so we do have a Facebook group on the Council Bluffs Walk to End Alzheimer's page or group that you can follow us for different fundraisers and things that we are doing locally. But he's my reason why and my passion for hopefully finding a cure to this disease someday. We're going to talk a little bit more about facts and figures, some of the national information versus just Council Bluffs or Iowa information. So please enjoy this minute-long video. Thank you for listening to and reading some of those facts and figures. Obviously, there are a lot of people that are impacted by this disease, over 6 million. These numbers that you saw in the video are from 2022. In 2023, it was estimated over 6.8 million people have a Alzheimer's diagnosis over the age of 65. So that doesn't include everyone. Obviously, there are individuals like our story where he is in his 50s and he doesn't have Alzheimer's. He has a different type of dementia. So that number obviously can be very much higher. There are over 11 million caregivers that take care of those individuals that are unpaid. And so we know that that number probably is pretty low as well. There are probably much more than 11 million caregivers that tend to help these individuals. This image is a little bit hard to read, but if you have any questions, I can always send it to you in an email or let you know the link. But this is really talking about the women impact. 2/3 of Americans that have an Alzheimer's diagnosis are women. We're just at higher risk. And also one of the things that I really enjoy about this information, this is the type of research that we do. We do over 1,000 different projects at any given time, not all about the cure or the medicine that we can hopefully get to someday to hopefully put me out of a job. But this is information on what puts you at higher risk or some of those things that we can see for trends to be on the lookout for if you're at higher risk or not. The number one risk factor is age. So as we get older, 65 is kind of that magic number that puts you at highest risk first. And then 85 is the next one after that. Women, obviously, beyond being a higher age, we live longer. And so that's why we're at higher risk, just in a very non-scientific way to put that. Just as a disclaimer, I'm not a physician, a social worker, nurse, fortune teller, pharmacist. And so these are just information and facts that we can give, hopefully at a level that all of us can understand. There is a higher likelihood over the age of 60 that women are twice as likely to develop Alzheimer's than breast cancer at this point. So 1 in 6 versus 1 in 11. And we are really about 20 years behind cancer research at this point. And so hopefully we'll get to a point where it is not as likely to get dementia, but right now we're at a point where it is. And so the pandemic was not friendly to the dementia community. Nearly 19% of women, Alzheimer's caregivers had to quit work or become a full-time caregiver at home. And so a lot of people were impacted for the caregiving aspect of that. And the other one here says that 1/3 of dementia caregivers are daughters. So I am definitely a statistic. And if you'd like more information on this, there's all kinds of different diverse groups that we have different impact reports like this on at alz.org. These are the different types of dementia. So dementia is an umbrella term. There are many different types of dementia, Alzheimer's being the most common. 60 to 80% of people that have a dementia diagnosis have Alzheimer's. So that's why they're used so interchangeably. Dr. Alzheimer's actually started his research in the early 1900s. So it's not a new disease. We're just getting better at diagnosing it. Alzheimer's looks different in the brain because of things that are plaques and tangles. So there are additions to our brain that are not wanted. Lewy body dementia is another type of dementia that is a very tough diagnosis to have. Thank goodness it's more rare than Alzheimer's, but this is one of the hardest ones as a caregiver, as they see things that we usually don't. And sometimes it can be very scary things. Vascular dementia is usually with younger people with cardiovascular things like strokes. So it's very common in 50s or 60s to have a vascular dementia diagnosis, especially if stroke has been in their history. Frontotemporal dementia is what my dad has. It is shrinkage of the brain in those lobes. So it really affects his problem solving, which is in front of him. So what you see in front is your frontal lobe, multitasking, and then temporal lobe is our communication. So typically when people think of dementia patients, they think of short-term memory loss or saying the same things over and over again, kind of like Dory from Finding Nemo, like we can't remember where we live, maybe off Wallaby Way. With frontotemporal dementia, it has actually taken his words. And so he doesn't repeat the same way that, say, if there was a typical Alzheimer's patient, it really took away his words. And so at this point, 4 years in, he's nonverbal. So very different caregiving styles between the different dementias. But not everybody is able to get these diagnoses. There's a lot of testing that is available. And the diagnosis that we see more frequently before dementia is mild cognitive impairment, which you saw in the video. And that is a really good way for clinicians to be able to document that there's something going on. We just don't know exactly what's going on just quite yet. So that is the predecessor diagnosis that we see clinically. These are some examples, hopefully to put some names with faces of impact of dementia. On the top left-hand corner, you'll see Robin Williams. He actually suffered from Lewy body dementia and depression before obviously We all know that he is no longer with us. So if you can only imagine some of the things that he knew with his comedic background and his acting and things, I can't imagine some of the things that he possibly hallucinated with or saw that we couldn't. And so Robin Williams actually had Lewy body dementia, and that's why we talk about him here. In the top middle is Seth Rogen. Seth Rogen is actually an advocate for legislative issues for Alzheimer's, as he has a connection. I'm pretty sure his mother-in-law had dementia. And so he does have a professional side to him. And so he advocates for laws to help dementia families. In the top right-hand corner is Brad and Kimberly Williams Paisley. Brad Paisley is a big country artist, if you're a country fan, and Kimberly Williams Paisley is from Father of the Bride with Steve Martin. She actually wrote a book about her mom having the same diagnosis as my dad, and she's a huge advocate for us in the Nashville area for raising funds for the Alzheimer's Association in her honor. In the bottom left-hand corner is Anthony Anderson. He is one of our advocates along with Samuel L. Jackson, especially during Black History Month, to talk about how they are one of the largest diverse groups that are impacted. So African-American and Black individuals are 2 times as likely to have a dementia diagnosis. Hispanics are number 2 at 1.5 times as likely, and then women are 2/3. So those are the top 3 groups of people that are impacted at a disproportionate rate. In the bottom middle is Chris Hemsworth, if anybody is a Thor fan. He just recently had a docuseries come out on Disney Plus called Limitless. He was trying to see how he could live longer and better. And throughout that journey, he found out through a blood test that he has the very rare gene for Alzheimer's. And so that doesn't mean 100% that he will have it, but his grandfather did die from an Alzheimer's diagnosis, and that's why he stepped away from acting at this point, since he is at such high risk. Like I said, that is very rare. Not everybody has that gene. And then in the bottom right-hand corner is Bruce Willis. He has the similar diagnosis as my dad, and his family has been very outspoken within the last year or so about talking about their journey and how hard it has been with Bruce's words and how he's had to step away from acting. So Bruce Willis's family is another one that we really appreciate telling their story. These are some of the statistics for Iowa. So on the left-hand corner, you can see that 66,000 Iowans have an Alzheimer's diagnosis over the age of 65. Like I said, that statistic is great, but it doesn't include everyone. My dad would not be in that statistic because he's younger and doesn't have Alzheimer's. By 2025, we're expected to see a 10.6% increase in that to 73,000 Iowans. So if you think about Council Bluffs, our population is pretty close to 66,000. If everybody that was 65 and above that had an Alzheimer's diagnosis lived in one city, it would be ours. So that's a lot of people, and it is expected to increase. We are seen as a dementia desert in the state of Iowa, with an expected increase for workforce demand of up to 450% by 2050 at least, for geriatricians specifically, but also workforce like CNAs, nurses, and direct care staff. So really, we want to make sure that we are encouraging those that have a heart for dementia to look into some of these workforce opportunities, because there will be lots of opportunities to do that if they have the heart for it. It is a tough career path, but in the state of Iowa, as of 2023, these numbers were released in March of this year. We had 26 geriatricians across the entire state that can do the specialized testing for these individuals. So not very many for our bigger state of Iowa. 98,000 caregivers are unpaid in the state of Iowa. Obviously, that's much larger. If we captured everybody, it's probably significantly larger than that. But a lot of those caregivers are in bad health shape themselves. And so some of the statistics on the top right there talk about depression in caregivers, and also them having chronic health conditions themselves. It is a very costly disease. We just came out with a announcement today, last night, that there is a new announcement for payment for the new Alzheimer's drug, lecanemab. Leqembi is the other name that we utilize for that. This treatment would be for early stage Alzheimer's diagnosed patients, and it's about $26,500 per year for this treatment. And so to think about Medicare being able to finally pay for that, that was the announcement that CMS is willing to pay for that payment, or that treatment, excuse me. On an average basis, you can see on here, it's costing us at least $20,880 Medicare dollars per person here in Iowa for a dementia diagnosis already. So if we could use a similar amount of money per year to hopefully help those individuals really have a longer amount of quality time, more time, we have been really seeing great success with some of the drugs that are FDA approved at this point for the first time in history. It does obviously affect our hospitals, our hospice companies, Medicaid dollars, and ultimately mortality, as we don't have a cure for this disease. But for every dollar that we raise to hopefully end this disease, 79 cents of every dollar goes directly to Alzheimer's care, support, research, awareness, and advocacy. In the nonprofit world, it's pretty average for 65 to 68 cents per dollar to go directly to the need. And so the Alzheimer's Association is proud to say that 79 cents of every dollar goes directly to that. What can you do? What can I do? So we always need volunteers for media. If you're willing to share your story, we need volunteers for walk day. We need volunteers for some of our other events that we do. So support group facilitation, research study. I'm actually currently in a research study as a caregiver to hopefully help with stress and cortisol levels for siblings that take care of someone with dementia. And there are research studies in our area that we can help with. And then obviously with the different educations like this, we do need volunteers that are able to do this as well. So if you're not too shy of an individual and willing to talk to people, reach out. We would love to have more volunteers. If you'd like resources, if you know of someone that's struggling, we do have a 24/7 helpline and crisis line. The number is here on your screen, 800-272-3900. You can always go to alz.org at any time as well. Both of those are open 24/7. The helpline is actually available in over 240 different languages. So it is very, very helpful for those dementia families that may be in different languages. In the Council Bluffs, Pot County area, we actually have a larger amount of Micronesian population. And so when doing some outreach to the different resources within that from the Pacific Island region, their dialects are also included in that 240 different languages. So please keep us in mind. Our most robust calls that we get are for Spanish resources, and we do have a whole Spanish portal as well. If you have any care or caregiving resources for community placement or medical needs or things like that, you can also call that 800 number at any time for questions like that. So we have two big signature events with the Alzheimer's Association fundraising to find the end to Alzheimer's, that cure. The longest day is for summer solstice. That is on June 21st this past year. It does change up, but the whole month of June is Alzheimer's and Brain Health Awareness Month. And so we do things all throughout June, all throughout the year for the longest day. These are great opportunities for creative minds to fundraise. We have some really great golf tournaments in the Council Bluffs area, scrapbooking, as you can see, lemonade stands and dance type of things. So if you're creative, this might be an option for you. And Marcia Williams is our local contact for this. The Walk to End Alzheimer's is what I do for 23 counties in Southwest Iowa. I oversee the Council Bluffs, Harlan, and Sioux City walks. If you'd like information on how to have a table at the walk, like I said, our Council Bluffs walk is September 23rd. And this is one of the most positive events that we have in the area to shed light on a hard situation. We can do this with all these different flowers you can see on this video. Each color means a different reason that people are walking or supporting. And so the white flower is the only one at the walk that we signify for the first survivor, ideally. If you'd like to walk, it is completely free to register. You can register at act.alz.org/cbwalk. These are some of the other dates of walks that are going on. In the state of Iowa, we have 19 walks statewide, and we also partner with our local chapters in Nebraska, South Dakota, Minnesota, and Wisconsin. So there are other walks across the Midwest, but these are some of the dates. I oversee the Council Bluffs, Harlan, and Sioux City walks. Harlan will be our first one on the 16th, and Sioux City will be the first. This is information. We do have a caregiver support group here at the YMCA Healthy Living Center on the third Tuesday at 11 o'clock. If you are interested in information on that or a flyer, please reach out. I'd be happy to do that. Or if you would like to be a support group volunteer, we would love to have you there as well. We do community education like this. The 10 warning signs and understanding Alzheimer's and dementia are some of my favorites. And we also have an event coming up next week here on the 100 block that Impact CB is helping us out with, and it is all going towards the Council Bluffs Walk. We will be talking about the history of the 100 block, the impact of a dementia family here that had a bakery on the 100 block, and also just some really fun trivia while supporting local. We do have 3 different drugs that are FDA approved on your screen right now. The one that was in the news last night is lecanemab, and donanemab is the newest one that we've been seeing the best results with. If you have questions on those, I can reach out. And this information right here talks about donanemab, which is the most recent one that we have been doing research on. And the manufacturer, as you can see here, reports that nearly half, which is 47% of the study participants taking donanemab had no decline of cognition and function for 1 year, compared to 29% of the placebo. So we are seeing great results with this, and I'm very sure that there will be more drugs coming down the pipeline that will have even better percentages. Our vision is obviously a world without Alzheimer's and dementia. That's why I do what I do. We always need more volunteers that are willing to help us get this job done. And if you have any questions on what puts you at higher risk, please let us know. We would be happy to answer those, or if you want to go to alz.org at any time, that's a great resource. This is my contact information. If you'd like to reach out via my cell phone number, it is 515-325-5287. If not available, I can always send it on to our care team that is available 24/7 at the 800 number from before. Thank you very much for listening in. Appreciate your attention, and please share our information with anyone that you think would be helpful. Have a good day.